Every single morning, you wake up and the first thing you do is clear your throat. That thick, sticky feeling that just won't go away, no matter how much water you drink, no matter how many times you cough. You've probably been told it's allergies, or the weather, or just getting older. But here's what most people never find out: that persistent mucus in your throat, the kind that's been there for months or even years, usually has one specific cause that has nothing to do with any of those things. And it's a cause that almost nobody talks about in the doctor's office because the appointment ends before they get there. Today, I'm going to show you exactly what that cause is, and more importantly, what you can actually do about it starting tonight. But before we go any further, I need to share something important with you. Everything you hear in this video is for educational purposes only. It is not medical advice, and it does not replace the guidance of your personal physician. If you've been dealing with persistent throat mucus for more than 2 to 3 weeks, or if you experience any warning signs like blood in your mucus, unexplained weight loss, difficulty swallowing, or a hoarse voice that won't go away, please see your doctor right away. Those symptoms need a professional evaluation. This video is designed to help you understand what might be going on and to give you better questions to ask at your next appointment. And before we dive in, I'd like to ask you something. If by the end of this video you find this information genuinely helpful, go ahead and type the word throat in the comments below. Just that one word, throat. When you do, you'll find a pinned comment with a link to our free guide, The Real Causes of Chronic Throat Mucus After 60. And what to do about each one. It's a simple one-page resource you can print out and bring to your next doctor's appointment so you can have a much more productive conversation about what's actually going on. No products, no supplements to buy. Just clear, organized information that puts you in the driver's seat of your own health. Type throat in the comments and the link will be waiting for you. Now, let's get into it. Before we talk about the specific causes, I want to explain something that completely changes the way most people think about throat mucus and why it's so often misunderstood. Here's the thing most people don't realize: mucus is not the enemy. Your body produces between 1 and 2 quarts of mucus every single day. That's completely normal. That mucus is actually doing an extraordinary job. It traps dust, bacteria, viruses, and allergens before they can reach your lungs. It keeps your airways moist and functioning properly. It's one of your immune system's first and most important lines of defense. The problem isn't the mucus itself. The problem starts when that mucus changes in consistency, when it becomes thicker, stickier, and harder for your body to move and clear naturally. And here's what makes this especially relevant after 60. As we get older, several things change simultaneously that make that thickening more likely. The muscles involved in swallowing become slightly less efficient. The lymphatic system, which helps drain excess fluid from the throat, works at a reduced capacity, and the tiny hair-like structures called cilia that line the airways and sweep mucus upward and outward don't move quite as effectively as they did at 40. The result is that mucus that would have moved through and cleared itself quietly in a younger body starts to sit there, to accumulate, to make itself known. Understanding that context is essential for understanding why the solutions work the way they do. Now let's talk about what's actually causing it. Cause number 1, and the one that explains the majority of cases in people over 60 who haven't found relief from antihistamines: silent reflux. Silent reflux goes by a medical name that you may not have heard before. It's called laryngopharyngeal reflux, or LPR. And the reason it's called silent is that, unlike regular acid reflux, it usually doesn't cause the classic heartburn that most people associate with stomach acid problems. Here's what happens. The stomach produces acid to digest food. Normally, a muscular valve at the top of the stomach, called the lower esophageal sphincter, keeps that acid where it belongs. But when that valve becomes weakened or relaxed, which happens more frequently after 60, small amounts of stomach acid and digestive enzymes can travel upward, past the esophagus, all the way to the throat and the voice box. Here's the critical part. The throat and voice box are dramatically more sensitive to acid than the esophagus is. So even a tiny amount of acid reaching the throat can cause significant irritation without producing any heartburn at all. When the throat is irritated by that acid exposure, it does what any irritated surface does. It produces more mucus to protect itself, not because there's an infection, not because of allergies, but because the lining of the throat is responding to a chemical burn that's happening at a microscopic level, over and over, usually at night while you're lying down. A landmark study published by researchers at the Mayo Clinic found that silent reflux was identified in up to 60% of patients who came in with chronic throat mucus and no obvious digestive symptoms. 60%. And many of those patients had never been told that stomach acid could be reaching their throat without causing any burning sensation. The classic pattern that suggests silent reflux rather than allergies is this. The throat clearing tends to be worse in the morning right after waking up because stomach acid rises more easily when you're lying flat during sleep. It often gets worse after meals, particularly after coffee, after acidic foods like tomatoes and citrus, after spicy food, and after eating large meals in the evening. And it frequently gets worse when you bend over or lie down shortly after eating. If that pattern sounds familiar, silent reflux deserves serious consideration as your primary cause. And the good news is that there are specific practical steps that address it directly, which we'll get to shortly. Cause number 2, post-nasal drip from chronic low-grade sinus inflammation. This is the cause that most doctors reach for first when a patient describes throat mucus, and they're right to consider it, because post-nasal drip is genuinely common, especially after 60. Here's how it works. The sinuses and nasal passages produce mucus continuously as part of their normal function. Under normal circumstances, that mucus drains smoothly and quietly down the back of the throat, gets swallowed, and you never notice it. But when the sinuses become even mildly inflamed, from dry indoor air, from low-level environmental irritants, from the reduced efficiency of the cilia we mentioned earlier, that mucus thickens slightly and starts draining in larger, more noticeable amounts. The result is that familiar sensation of something dripping or pooling at the back of the throat. What makes this particularly relevant after 60 is heating and air conditioning. Most older adults spend the majority of their time in indoor environments with forced air systems that dramatically reduce humidity. When indoor humidity drops below 30%, which is common in heated homes during winter and air-conditioned homes during summer, the nasal passages and sinuses compensate by producing thicker, less fluid mucus that doesn't drain as easily. The pattern that suggests post-nasal drip rather than silent reflux is slightly different. The mucus tends to feel like it's dripping or running rather than sitting and thickening. It's often worse during seasonal changes or in response to specific environments, and it frequently improves when you're in a more humid environment, like a shower or a bathroom with steam. Cause number 3, certain medications that are extremely common in adults over 60. This is the cause that almost never comes up in conversations about throat mucus, and it's one of the most important ones. Several categories of medications that millions of older Americans take every day have documented effects on mucus production, throat irritation, or the mechanisms that clear mucus from the airways. The first category is ACE inhibitors. These are blood pressure medications, lisinopril, enalapril, ramipril, that are among the most widely prescribed drugs in the country. ACE inhibitors work by blocking an enzyme that breaks down a substance called bradykinin. When bradykinin accumulates, it can cause a persistent cough and throat irritation in some people that produces exactly the same sensation as thick throat mucus. This side effect is well documented and affects between 5 and 20% of people who take ACE inhibitors. Many people have been on these medications for years without ever connecting the two. The second category is antihistamines, particularly the older generation of antihistamines like diphenhydramine, which is the active ingredient in Benadryl and many over-the-counter sleep aids. These medications dry out mucous membranes throughout the body, which sounds like it might help. But what actually happens is that the mucus becomes thicker and stickier, not less. it dries out and becomes harder to clear, which can actually worsen the feeling of congestion and mucus even while reducing the total volume. The third category is certain medications for overactive bladder and other conditions that have anticholinergic effects. These medications work by blocking the part of the nervous system that controls various glandular secretions throughout the body, and they can affect mucus production and mucosal moisture in the throat in ways that make chronic throat clearing more likely. The question you should bring to your doctor is this: I've been dealing with chronic throat mucus, and I take these medications. Is there any documented connection between what I'm taking and this symptom? And are there alternative medications in the same class that might be less likely to cause this effect? Because number 4, airborne irritants inside the home that most people never identify. This cause is particularly relevant for older adults who spend a significant portion of their day at home and who may never have connected their indoor environment to their throat symptoms. The most common indoor irritants that contribute to chronic throat mucus after 60 include the following. Scented candles, air fresheners, and plug-in fragrance products contain volatile organic compounds that can irritate the mucous membranes of the throat and sinuses even at concentrations that have no detectable smell. Because exposure is continuous and low level, the body doesn't produce an acute allergic response. It just maintains a low-grade state of irritation that results in persistently elevated mucus production. Cleaning products, particularly those with strong chlorine or ammonia content, can cause the same effect. The irritation from cleaning products doesn't have to happen during the cleaning itself. Residues in the air or on surfaces can maintain a low-level exposure for hours after the cleaning is done. Mold, even at concentrations below what would be considered a serious health problem, is a significant contributor to chronic throat and sinus irritation. Bathrooms, basements, and areas around windows in older homes are particularly common locations for low-level mold growth that the occupants may not see or smell, but that their airways are responding to every day. And finally, pet dander, even in people who have lived with pets for decades and who don't think of themselves as allergic, can contribute to chronic low-grade airway irritation that results in excess mucus production. The practical test for this cause is simple. Pay attention to whether your symptoms improve significantly when you're away from home for a full day, at a family member's house, at a hotel, anywhere outside your regular environment. If your throat feels noticeably clearer after a day away, something in your home environment is likely contributing. Now let's talk about what actually works. Because understanding the cause is only valuable if it leads to something you can actually do. So let's go through the most effective practical steps for each of the causes we've covered. For silent reflux, the single most impactful change you can make tonight is elevating the head of your bed, not just adding an extra pillow, which often only flexes your neck without actually raising your torso. What works is elevating the entire head end of your bed frame by placing a wedge or a book under the legs. An elevation of 4 to 6 inches changes the angle enough to significantly reduce acid migration into the throat during sleep. The second most impactful change for silent reflux is adjusting your evening meal timing and composition. Eating your last substantial meal at least 3 hours before lying down gives the stomach enough time to empty significantly before you're horizontal, and reducing the foods most likely to relax the esophageal valve, coffee, alcohol, chocolate, mint, fatty, and fried foods, and acidic foods, particularly in the evening, can make a noticeable difference within 1 to 2 weeks. The third change is drinking water in small sips throughout the day rather than large amounts at once. Staying consistently hydrated thins the mucus that forms as a protective response to acid exposure and makes it much easier to clear. For post-nasal drip from chronic sinus inflammation, the most evidence-based intervention is nasal saline irrigation. Using a nasal rinse or a neti pot with a proper saline solution once or twice a day physically washes out the irritants, thickened mucus, and inflammatory debris from the nasal passages. Multiple clinical studies have shown that regular nasal saline irrigation reduces symptoms of chronic post-nasal drip significantly in the majority of adults who use it consistently for 4 or more weeks. The technique matters. The solution should be made with previously boiled or distilled water. Never tap water directly. With a small amount of non-iodized salt and a pinch of baking soda to bring it to a pH that doesn't sting. And the temperature should be warm rather than cold, which makes the experience much more comfortable and effective. Adding a cold air humidifier to your bedroom with a target humidity of 45 to 50% addresses the dry air component that is so often a contributing factor, particularly during winter months. Make sure to clean the humidifier's reservoir every 3 days to prevent mold growth inside the device, which would replace one source of irritation with another. For medication-related throat symptoms, the most important step is bringing a complete list of your medications to your next appointment, and specifically asking whether any of them have documented connections to cough or throat mucus as side effects. This is a conversation that many people never have, not because their doctor wouldn't address it, but because it never comes up in the context of the symptom. Your pharmacist is also an excellent resource for this conversation and is often more immediately available than your physician. If you take an ACE inhibitor and have persistent throat clearing that hasn't responded to other interventions, ask your doctor whether an ARB, an angiotensin receptor blocker, which works through a different mechanism without the bradykinin effect, might be an appropriate alternative for your blood pressure management. For indoor air quality, the most impactful first step is a simple elimination process. Remove all scented products from your home for 2 weeks. Candles, air fresheners, fabric softeners, dryer sheets. Use only unscented versions of all cleaning and personal care products during that period. If your symptoms improve significantly, you've identified the category of irritant and can reintroduce products selectively to find the specific culprit. Consider an air purifier with a true HEPA filter for your bedroom. The bedroom is where you spend the most hours in any single space, and reducing the particulate load in the air you breathe for 7 or 8 hours every night can have a disproportionately large impact on daytime symptoms. There are also 2 habits that make throat mucus worse, regardless of the underlying cause, and that are worth addressing directly. The first is habitual throat clearing itself. I know this sounds counterintuitive, but the forceful clearing motion, while it provides a moment of relief, actually traumatizes the delicate tissue of the vocal cords and throat lining with each repetition. That microtrauma triggers more mucus production as a protective response, which leads to more throat clearing, which causes more trauma. It's a cycle that perpetuates itself. The replacement behavior is a small, gentle cough with the mouth slightly open, like saying, combined with a small sip of water. This clears the throat without the traumatic force of the habitual clearing motion and breaks the irritation cycle over time. The second habit is mouth breathing, particularly during sleep. When air passes through the mouth rather than the nose, it bypasses the humidification and filtration systems of the nasal passages and arrives at the throat dry and unfiltered. That dry, direct airflow dries out the throat lining and stimulates protective mucus production. If you tend to sleep with your mouth open, or if you wake up with a dry mouth in the morning, addressing this through nasal breathing exercises during the day, through treating any nasal congestion that's forcing you to breathe through your mouth, or in some cases through a consultation about sleep-disordered breathing, can significantly reduce nighttime mucus accumulation and morning throat clearing. Before we wrap up, I want to talk about when to stop managing this at home and when to make an appointment a priority. The vast majority of chronic throat mucus in adults over 60 is caused by one or more of the 4 things we've discussed today and responds well to the approaches we've covered. But there are specific warning signs that mean this needs professional evaluation right away. If you have blood in your mucus, even a small amount, see your doctor promptly. If you have difficulty swallowing or a sensation that food is getting stuck, that needs evaluation. If your voice has changed, become hoarse, weaker, or rougher, and hasn't returned to normal within 2 to 3 weeks, see a doctor. If you've lost weight without trying to, or if you have persistent ear pain on one side, those symptoms together with throat mucus warrant an examination. And the general rule of 2 weeks. If you've applied the approaches in this video consistently for 2 weeks and seen no meaningful improvement in your symptoms, that's the signal to make an appointment. Your doctor can do a direct examination, and in some cases a referral to an ear, nose, and throat specialist that will give you information no video can provide. Before I close, I want to say something directly to you. If you've been dealing with this for months or years and you've just accepted it as part of getting older, you don't have to. Chronic throat mucus is not an inevitable consequence of aging. It is almost always caused by something specific and addressable. The 4 causes we covered today, silent reflux, postnasal drip, medication side effects, and indoor irritants, account for the vast majority of cases in people over 60. Most of them respond to changes that cost nothing and require no prescriptions, and all of them are worth investigating with your doctor if you haven't already. You now have the information to make that conversation much more specific and much more productive. If this video helped you, remember to type throat in the comments to get the free guide. And if you know someone who's been dealing with that same morning routine, wake up, clear throat, start the day, share this with them. Because sometimes the explanation that finally makes sense is the one that someone who cares about them passes along. I'll see you in the next video.